Hello, my name is Joseph Dayan. I'm a plastic and reconstructive surgeon, and I work at the Institute for Advanced Reconstruction. I've been in practice for 15 years. I like challenging things, so I specialize in lymphedema, breast reconstruction, facial nerve, facial reanimation, and peripheral nerve surgery, and I also do cosmetic surgery. Before being a surgeon, I am a doctor and just like to take care of people. I think since I was a kid, I took care of my grandmother, who unfortunately had advanced Parkinson's disease, and so I went through the medical system long before medical school. And I think that impacted me and sensitized me to how important it is to listen to a patient, to be empathetic, and how stressful it can be for a patient when they're seeing a doctor. Caring for somebody when they're at the time where they're at most distressed, sometimes facing their mortality, humbles you, it grounds you, and gives you good perspective in leading a good life. So I'm very, very grateful to the field of medicine and everybody that's helped me get to where I am. Getting an MBA at my point in my career was really because there are patients with problems we can't solve on the front line. Doctors every day, we either don't have a drug or a device or a surgical procedure or a way to see what we cannot yet see. I went to business school to be able to get exposed to new technologies that may help my patients, and honestly, patients across the full spectrum of medicine. All of medicine is interesting to me, not just plastic surgery, and in fact, many of the ideas that I got to improve surgical procedures that we have in plastic surgery that I went on to pioneer came from cross-training with other specialties, whether it's head and neck or breast surgery or surgical oncology. So getting outside of your cave and seeing how other people with a totally different skill set do things, including engineers and scientists, I'm most excited about because it gives patients hope that don't have hope right now with our current technology. I am leading innovation at the Institute for Advanced Reconstruction, giving a big push to innovation in order to introduce new technologies that may benefit our patients and really staying on the cutting edge. I think that with new technology, you can either be a passive recipient of whatever kind of floats down the river, or you can be an active participant, because sometimes there are technologies with great potential, but they do need a little guidance from the frontline clinicians to make them most effective to help a patient. And so there is an opportunity where you can really help patients by help guide the use and application of these technologies. And so I prefer to know more about any information, even if the technology may be good or a false pot of gold. I want to at least investigate and see with my own eyes so that the patients have a benefit of being the first to know if there's something potentially that might benefit them. The future vision for the Institute for Lymphatic Surgery and Innovation is really to explore all techniques, drugs, surgical procedures, non-surgical procedures, any intervention that may benefit our patients. Lymphedema is currently an incurable disease. There's no way to measure lymphatic function quantitatively, which is a big barrier to advancing it. Like, it's hard to know if something actually worked, how well it worked, how you measure that. There are various ways to measure it. So it's really bringing latest technology to the field of lymphedema and taking lymphatic surgery and treatment of lymphatic disease to the next level. I am deeply humbled and privileged to have been a recipient of the ASRM Godina Traveling Fellowship. It is a special award in commemoration of Dr. Marco Godina, who tragically lost his life in a car accident. He really changed the way people see traumatic reconstruction. I can't express how important it is and how important it is to me and how deeply grateful I am to receive that award. It is a reward where you're expected to do lifetime service in terms of passing on knowledge, learning, and carrying the torch for other younger, smarter, and hungry surgeons and supporting rising surgeons so that they can fulfill their potential.